what's up? Welcome to my channel. I'm myself Dr. Hilary. I'm currently pursuing my master's in prosthetic dentistry, Crown and Bridge, and also a part-time YouTuber. So this video is about MDS in prosthetic dentistry. How is it as a branch? What are the scopes and opportunities which are there after completion of MDS in prosthodontics? And also I'll give you some advice on selecting a college, especially if you are looking for MDS course, especially in prosthodontics. Okay, so what kind of college, what kind of department you should look for. So stay tuned till the end, and if you have not subscribed to my channel yet, then please do subscribe it, because I have a lot to offer. A lot of informative content is coming on your way. So now, any further ado, let's get started. Okay, so first of all, I'll brief you with the complete curriculum of 3 years. What are the things which you should do? Before starting this video, I want to tell you that, MDS is 10x harder than BDS. Okay, so be prepared mentally and physically. Okay, as a prosto PG, your life is going to be exhausting. Okay, and just because you need physical stamina as well and mental stamina as well. Okay, so now talking about the curriculum, see, in the first year you have basically first 5 to 6 months are your preclinicals, where you perform all the exercises: CD, cast partial denture, fixed partial dentures, okay, and also maxillofacial prosthesis. Preclinical work you do. Okay, and after that your clinical session starts. In clinics, I think I would name the variety of cases which you should do, or what is there in the PG, prosto PG curriculum. Okay, so it starts with complete dentures, okay, then removable partial dentures, both this acrylic flippers and cast partial dentures. Then in the fixed partial dentures, and the types of, there are different varieties of fixed partial dentures, okay, that also you do. Then there is full mouth rehab cases, okay, then there are smile designing cases, then implantology. I think implantology is one thing which varies very differently from different parts of India. I've heard very diverse reviews. Like in some colleges don't allow students to do implantology on their own. They do it under someone's supervision, and that too hardly 1 or 2 implants. And on the other side, there are colleges like mine where we are doing from the single implant to the full mouth cases, full mouth implant cases. Okay, so and also advanced implantology cases. So it depends कि आपका college कहाँ पर है, how is the staff, and वो कितना flexible है with this thing, and also whether you are getting patients of this level or not. Okay, so that implantology and the maxillofacial prosthodontics. So these are the different types of cases which you should do as a PG. Okay, and in smile designing, it also includes porcelain veneers as well, which is very much into trend. If you are living into a metro city or planning to settle into metro city, then these are the skills which you should have, which you must have as a prosto PG. And all these cases are expected to these cases you should do it. At the end of your 3rd year, you have to prepare an album of your cases, and it should include all these cases. And one more thing which I've missed is temporomandibular joint disorder. Okay, so you also need to treat TMD patients, and you need to do cases which are related to TMDs. Okay, so this was about the clinical part. Okay, apart from this, I will talk about the academic activities, which is a very huge part of this curriculum. And it starts with 12 seminars and 12 journal club presentations. So journal club is where you have to present any case report which is done by some other clinicians or some other doctors, and it is published in a standard journal. So you read that article and then you present it, and there is this discussion. So there are seminars, there are journal clubs. Okay, apart from this, you have 2 main university examinations. First is at the end of your MDS part 1, which consists of all the basic science subjects, and the second examination is at the end of your 3rd year, which is very exhausting, and it is a very extensive exam. It goes on for, like, in the 3rd year also you'll be having 3 papers, 3 theory papers, and 3 days of extensive examination of your practicals. Okay, so this is about the academic activities, and apart from this also you have to take lectures for undergraduate students, which is also a very important part of your MDS life. Okay, and as a Prostho PG, I feel that Prostho is the most vast subject out of all to study it in depth. Like I already told you the different treatment which we have to do, or the different kind of cases which we do as a Prostho PG. So also all those topics, okay, like TMD, smile designing, RPD, CDFPD, all those things you have to read in great detail. Like there are 3-4 books for each of this subject of Prostho. Okay, so that you need to read and grasp those concepts, and that's where you become a prosthodontist. And then if we talk about the scopes and opportunities which are there after completing Prostho, then see, prosthodontics, I feel like it is a very important part of dentistry. अगर किसी को भी अपना clinic अच्छे से चलाना है, they need to have a good hand in Prostho. Okay, so if a person is lacking that, obviously they're gonna ask you for consultations, but I would say that not a great flow is there as a consultant. Okay, but yeah, you can start your own practice, and for your consultations your main cases will be that complete denture for resorbed ridges, okay, or implant prosthesis is something which is your specialty, which is our specialty as a prosthodontist. So that is where you will dominate. For that, people can call you. Also for the TMDs, for the smile designing, for the veneers, for the full mouth rehab cases, these are the cases for which you can get consultations, where you can work at other clinics for cases like this. Okay, and also you can start your own practice. Also there are lots and lots of fellowship courses which are going on for implantology, for the temporomandibular joint disorders, which are here in India also and in abroad also. If you wish, you can definitely join it. It's a 1-year ka course, and then it adds into your specialty. Okay, and apart from this, I guess, yeah, that's it. I have shared a very detailed review of how this MDS curriculum is, scopes and opportunities are. Okay, and yeah, if one more thing is that if you are planning to settle in metro, or already you are in a metro city, I think you will be in a demand as a prosthodontist. Okay, as of now, and since the last 5 years, I think demand of prosthodontists have increased because of the digital dentistry, because of the full mouth rehab concepts and the cases which are becoming very much routine into practice. Okay, and also the porcelain veneers and all these things are very much into practice, in demand, as the aesthetics are very much into demand. People want to look more young, youthful, and they are aiming for this perfect smile. So with that, this branch is gaining a lot of attention since last 5 years, and touch wood, it remains the same. Okay, and then if I talk about as a student, okay, that how your life will be as a Prostho PG, you will be very busy, very busy, and it will be a very exhausting years after years. So all these 3 years you are gonna be super busy. बहुत सारा काम होगा, बहुत सारा लैब वर्क होगा, बहुत सारे रिपीट इम्प्रेशंस आएंगे, बहुत सारे रिपीट क्राउन्स आएंगे. Okay, but you need to have that mental stamina and that physical strength to pass all these things. And it is something where I feel that, okay, I feel very fortunate or grateful to get this branch. Okay, that's all for the video. If I'm missing anything, and if you still have any query, you can surely write it down in the comment section below. Also, I have a very active Instagram channel, and that is @DentoWoman. Okay, the links are in the description box below. I share my PG life, I share my cases, I share a lot of things over there. If you feel like connecting with me, you can surely join me over there. If you have watched this video till here, thank you so much, and don't forget to hit the like button.